Over 50% of these patients can be saved by just taking these medications day in and day out. If you take these medications, the chance of relapse, the chance of overdose and dying drops by over 50%. But only 25% of these patients are able to get these medications. And it's so sad. There's just not a strong consensus on how to treat these patients. And that's what makes treating addiction medicine so difficult.
Hi, everybody, friends and colleagues out there in the world. I'm here with my two wingmen, Dr. John Hsu and our COO, William Pedrante. He's got lots of experience here in the pharma world, and we have John Hsu, who has been a doctor for a very long time in the addiction and anesthesiology world. And we are here today to talk about our why. Everybody out there and LinkedIn and our communities seem to be a topic of conversation of the things we're frustrated about in the industry and why we do what we do. And we really just wanted to get together and talk about that and invite other friends and colleagues to talk about it with us. So, John, why don't we kick it off with you? Tell me why you chose addiction of all of the medicines that you've practiced. Why would you bang your head against the wall on a daily basis?
Well, I didn't start out this way. I started out cardiothoracic intensive care, did a couple of fellowships in that in my anesthesia residency. And then in 2016, the CDC came out and said that no one should be on more than 90 MMEs of opioids. And then I started getting a lot of patients with opioid use disorder, opioid dependency. And pretty soon I kept on getting more and more patients to a point where my anesthesia practice in cardiothoracic and intensive care began to go down, and my pain and addiction medicine started to go up.
So, how did that feel? Like that change from being a doctor in anesthesiology, the hospital world, that corporate medicine environment, to treating addiction patients? How did that environment change for you?
Oh, it was really frustrating because, in cardiothoracic and intensive care, everything is done by the second, by the minute.
Mhm.
And we do something in medicine, and then we see the result. In pain and in addiction medicine, it takes a long time, really a long time, to make a difference. I mean, one of the things that happened to me is that I was late to clinic one day, and I saw my patients going from car to car. I kind of thought, wow, my patients are all friends. That's kind of cool. And then I started talking to one of my patients, and he started laughing because he said, you get so angry when our pill counts are not correct, that we make sure our pill counts are correct because we sign a contract for being in pain, in addiction medicine, just to see you. That's when I really figured out that, my job is really difficult. I cannot tell if a patient's taking their medications as prescribed or not.
So they're out there counting pills and they're saying, I only have 5 pills, I need 5 more. And then when the other one come out, they would change their pills around so everybody had the right amount when they saw you.
Yes. I don't
Nice.
look like a very mean doctor, and I really have changed my demeanor. I used to be, but with these patients, it's so difficult because over 50% of these patients can be saved by just taking these medications day in and day out. If you take these medications, the chance of relapse, the chance of overdose and dying drops by over 50%. But only 25% of these patients are able to get these medications. And it's so sad. There's just not a strong consensus on how to treat these patients. And that's what makes treating addiction medicine so difficult.
Yeah. Well, as a doctor and me as a nurse, it's been a long time since I've been out there on the floor, but we're trained to save and treat and heal. And we have big hearts and lots of empathy. And so, Will, turning to you, what makes a pharma guy go from the side of evil pharma to, hey, we're going to save the world? How did you move from pharma to addiction, the healing and trying to help people? How did that change? I mean, not that pharma doesn't try to help people, right? Like that's the purpose,
Right.
but the perception is out there,
Big
right?
bad pharma. Yeah,
Right.
yeah, no, absolutely. Yeah, yeah, for sure. Well, thank you, Kendra. So thanks for being a part of this and letting me be part of this. I'm super excited about the saving dose, our first episode. I'm super excited with Kendra and you and John to be participating as hosts as we talk about really exciting and fun topics that I think are going to be very helpful to clinicians, to business owners, to investors, entrepreneurs, patients, right? As we dive deep into, some of the challenges facing the addiction space and other areas that I think have an impact. So very, very excited. I'll tell you a little bit about my background real fast. I'm actually an attorney by training. Got my start at a large international law firm many, many years
So
ago.
a double bad
Um,
to a good? You get
I
brownie
know
points.
exactly,
You
right?
get brownie points there.
Seriously. So,
Yeah.
but as they say, I'm a recovering attorney. So I'm trying
Okay,
to
all right.
get as far away from practicing law as I can. But yeah, I started off as a big law firm, and to be candid, I think the last, I've been 20 years in the life science space now, and I think the last science class I took was oceanography at USC as a freshman, and that was because you got a free trip to Catalina out of it. So really, I kind of fell into this amazing industry of space of life science, really because of clients, right? I went to work for a big law firm, got lots of clients based out here in Orange County, California. And I had one particular client was an oncology company. It was small, but growing. It had some really exciting, products in development. I was doing a ton of work for them. They didn't have an in-house counsel. And eventually, after a number of years of working for them, I think the CEO got tired of paying my high rates as a lawyer at the law firm and brought me in-house. And that really introduced me and opened me to the world of life science. And that was a real introduction. This was a tiny little company, early stage. We had a couple products that we were moving into the clinic, and we were public. So that was kind of exciting. And it was just a way we went. And I like to say that experience, I was there for a number of years. And I like to say that was really the complete anatomy of a biotech. I learned the anatomy of how to build a biotech company from working at this company. From
Yeah.
starting with just 10 people when I started there, we ended up with several hundred by the time I was done, struggling to make ends meet because we're raising a couple $100 million in the capital markets. So knowing a lot about the challenges of raising money, raising capital, motivated investors to invest in companies and why. We did a ton of business development work. We were in licensing stuff, out licensing stuff, buying companies, selling assets, back and forth. Learned a ton about that. Dove deep into regulatory stuff. We got several products approved and launched. So I learned a lot about the regulatory process from INDs and NDAs and annual filings, all the challenges going along with that. I learned a ton about intellectual property. I'm not an intellectual property lawyer. I learned the critical importance of protecting your assets. You invest tons of time and energy into this products, and largely what you have to protect them is IP, right? They're not physical. You don't have physical
So by
things like we're not
IP,
building. Yeah,
what do you mean by IP?
Yeah, intellectual property, patents, right?
Mm-hmm.
Because we're not building cars. We got
Right.
100,000 cars sitting in a warehouse. It's all intellectual property,
Oh,
right? It's
true.
patents that you're filing around what you've built that give you the protection that go out for many years. That's the value you got, right? To be able to protect that and launch that and to keep others, right, from copying what you got. That's the value you're bringing, that people are interested in what you have in your company. So learned a ton about intellectual property about companies, learned a ton about compliance, right? And just doing things right and building a compliance infrastructure within a company to make sure you comply with all the various laws. I mean, the amount of laws that are out there internationally, because we did studies internationally when I was at this company, right? International laws, federal laws, state laws, right? That you have to comply with as a pharmaceutical company are fast. So developing programs, right? To make sure you don't run afoul of these various rules and regulations and laws that you have to comply with,
In
right? So learned a
addiction,
lot. A lot of my, go ahead.
I was to say in addiction treatment, that's one of our biggest struggles is compliance and regulatory law. Even it seems like every state has a regulation and then there's federal regulations and there's regional regulations. So a lot of our colleagues really struggle with trying to make sure their documentation is right. And then the payers want something else. And it is a bane of our existence because they can come scoop back money up to 6 years later, 6 years. So in pharma, is it like that? Does the FDA come and really give you penalties like that, or is it really just kind of on the medical treatment side?
No, it is on both sides, right? It's super challenging, right? Particularly for a small company, you've got limited resources and you're trying to go fast, right? Trying to push things, move things forward, get things down the pathway, but making sure you're doing things the right way, right? Right way from a regulatory perspective, right way from a compliance perspective, right way from, clinical studies, non-clinical studies, and manufacturing, doing all the things the right way to know everything you need to know, to be able to afford all the consultants and attorneys and other people you need can be very, very challenging at a small company. So I learned a ton
Yeah.
about managing that process, right? Because it is managing risk. You know, there's no perfection, right? You're always striving to do everything perfect, but everybody falls short. So it's getting it 90 to 100, 90 to 95% right, right? And keeping things moving forward at the same
Well,
time.
I
I
take
learned a
back
ton
everything
about
I
that.
said. This sounds easier than that. But I take back all of the bad things I said. This sounds way easier than that. So, John, have you
Yeah.
struggled with regulatory issues or licensing and kind of insurance takebacks and stuff in your practice?
That's a lot of questions, but yeah, you
Yeah,
know,
yeah. The short answer is yes. Everything,
yes,
right?
yes, yes, and yes.
Yeah.
I have two pharma companies as well. And these two pharma companies are all in the opioid space. I'm trying to prevent problems in the opioid space. And that's the easy part. You know, science is the easy part for me. The business part, insurance claims, insurance coding, collections, that's the difficult part because, you know, just the other day I had a call from an insurance company. They were asking for money because the patient didn't do well and they thought that it's my fault that the patient
Yeah.
didn't do
Yeah,
well.
it's
So they
it's
were
always
asking for
amazing
money back.
how the providers blame for it. So, much like Will, that's kind of how I got a lot of my industry experience. I started really young, right out of high school. I went to nursing school and you end up working for these large corporations. And before I even graduated nursing school, I was already working in the business office and at the front desk and scheduling nurses and whatever. And at that time, I was in the skilled nursing industry. By the time I progressed in my career and I worked on and off for UHS, one of the largest hospital chains and medical acute chains and subacute chains in the nation. And I learned just a ton of experience and I got sucked from the nursing floor into administration eventually. I mean, obviously this is a fast forward version. But yeah, you get all of that experience and when your passion can take over what you do, you really can win. Right. And I think that's the message for all of our colleagues. And none of us would be in this industry if we didn't have some kind of passion for treatment of addiction clients because we have hope. We have hope for them and we have hope from their families. And I think everyone I've ever worked with stays for the why because they've been touched by it. There's very few people that their family, their someone they care about, someone at church, someone, they can see the pain. And so if they can change the pain in the world and you have a capacity to do that, you kind of feel like you have to use those talents for good, right? If you can, right? And so if someone's going to be able to give you a salary to do that every day, you have to do it, right? It's
Mhm,
not much of a choice. So that's my why. Like I
mhm,
really believe that for every family that's called me and said, thank you. Thank you for allowing us not to lose our house. Thank you for fighting the insurance company so my child, whether they're 15 or 50, didn't die today. That's powerful. And
mhm.
and it means that although I had pain for the last 2 weeks at work, that one day will carry me again for a month. So, John, is it the same
Yeah,
way for
yeah.
you when you can see maybe that someone's making progress, that it fuels you to carry on? I mean, what you've been trying to get one of your devices through regulatory since, gosh, I've known you since 2015. You've been carrying this thing around in a box all over the country, trying to get people to invest in it. You've talked to every politician on the face of the planet. You've used your own money to slog around the country, come hell or high water, snow, rain, sleet. But yeah, you really have been a champion. But yet you very particularly haven't been touched with addiction or your family member hasn't. It's just that you believe in the healing power of people. And so tell me why you continue to carry this banner.
Well, Kendra, you're really impressive. You've really helped a lot of patients. And on behalf of patients, I want to say thank you.
Oh, thanks.
Well, the reason I do it, I started off in the medical field and went from one field to another. But 4 years ago, I had a heart attack. And this heart attack, my heart rate was down to 10. I kind of thought I was going to die. And I said to myself, in the last time that I lay my head down, I'm going to try to do something to help people as much as I can. And I think what I'm doing now is I'm really trying to help as many people as I can because people with opioid use disorder, people with substance use disorder, opioid use disorder, cannabinoid use disorder, they're ignored. There's a
Hmm.
huge stigma,
Yeah.
there's a huge privacy issue, and no one's helping these people, and they're ignored. And it's costing our country $2.7 trillion a year, and there's 100,000 people dying, and these medications are not that expensive. And I wish I could get all these people on medications
And
and
insurance companies don't
buprenorphine.
want to pay. One of the hardest claims to get paid ever are mental health and addiction claims. And
Mhm.
there's some payers that are way worse than others, and we all know who they are out there. But yes, not mentioning any names, but yes, there are some that are just terrible, and it makes it hard. It makes it hard for providers to carry on. And um, I think I saw a statistic that so many providers are leaving the addiction industry and going even over to emergency medicine because they just don't want to have the regulatory burden of the DEA licensure. And some states have more regulatory scrutiny for those Schedule II drugs than others. And then the second part is just getting paid. It's too hard to have a practice. And so they're closing down their practice. They're going to work for a hospital. And even if it's in the ED, it doesn't matter. They're just happy to be done with the pain, right? So, Will, even though you haven't been touched by this, I think when I talk to you, it's also for the future of your family, to make sure that in your community and around, the people that that you can make a
Mhm.
difference in their world as well.
Yeah, absolutely. No, thanks, Kendra, and thanks for sharing your why, and John, your why too. I appreciate all you guys are doing. What you're doing, it's a thrill for me and a real pleasure and a privilege to work with you guys in this space
Hmm.
to try to come up with solutions to the very challenging
Yeah.
addiction crisis we're dealing with, here in the United States and eventually all over the world, really. Right. So, but I'll say two things that are driving my why and what inspires me to get excited about what we're doing here every day is first, I recently did a post on this on LinkedIn just recently, and that is, I've got 5 kids, and my oldest is 22, and so we do a winter trip, we go skiing, and we do a summer trip where we go to the mountains too and go mountain biking. And I've been doing that probably since the 22 was 3 or 4 years old. And so for the last 18 plus years, I've been loading up 5 kids, trekking up to the mountains. And you can imagine, right? You have a lot of children. I know too, Kendra. John's got 3. And it's all it is logistics. Like literally for a week, it's just logistics, right? It's loading them up, it's getting them fed, it's getting them clean, it's getting them dressed, it's getting their skis and boots and poles and all this other stuff, getting their lift tickets, making sure they get their mountain. They do a little bit. They all got to come in for lunch. You got to take your jacket off, eat lunch, put it back on, go out. You forgot your mittens,
It
forgot
is
your
not a
goggles, got
parent
this.
vacation.
No, it's not. And you've been doing that forever, right? Loading it up, and it's chaos, it's challenging, it's exhausting, but you love it. It's why I have 5 kids. It's awesome. It's fun, particularly at night when you get back to the house you rented and you're all sitting down for dinner and you start playing board games and laughing and seeing the interaction of your kids. And especially as they get older, they have adult relationships with each other. It's awesome. Well, this year, same thing, week or so ago, spring break hit. So time to load everybody up and take them to skiing. But instead of 5, I had 1. And 2 are off. One's graduating from college, the other one's in the Marines. 2 are in high school, and he was working. My younger one in high school, she went to Hawaii with a friend. So I was left with my just 1. And it kind of hit me, honestly, a little hard. I got in this car and I'm ready to drive to Mammoth, and I just got 1 kid with me. And I'm just looking back. I love him, and I'm thankful that I get that time with him. But there was a little bit of like, gosh, what happened here? Where did all this go?
Yeah.
Right?
Sweet
In
sorrow.
life. And it taught me certainly that time keeps moving. Time keeps
Mhm.
moving. And life is full of seasons, right? That you live at various parts of your life. When you're young and you're a teenager and you're 20s, 30s, 40s, 50s, that it does. Life has its seasons of where you're focused and what your energy is and what you care about. And certainly at home, as I was thinking about driving up there with my son and thinking about all this, it showed me really the time keeps moving. And particularly as you get older, I'm in my mid-50s now, it's time is so valuable. And I only want to spend it doing stuff that really is meaningful,
Yeah.
right?
I mean,
Really
even
meaningful
something
stuff that
so
matters.
simple, at this point
Yeah.
in our chapter in our life, even something so simple as I'm going to go buy a mixer, right? Like I want to love anything I buy anymore. Like it's not out of
Yeah.
necessity. Like I have to love it to
Yep.
buy it. And I think that's
100%.
for the same thing. If you're going to spend 8 hours in a room somewhere, love what you do, right?
Yep.
There's lots of parts
Yep.
of our industry that I hate, literally hate. And I know that's a very terrible and strong word, but I think all of our friends and colleagues out there can say, oh, there's things I hate, but
Yeah.
because there's pain associated with it, right?
Yep.
But
Yep.
and for
Of
our
course.
friends
So,
and colleagues out there listening, tell us your why. Tell us what you hate and
yeah.
what you love so that we can have more conversations about it.
Yeah. Well, I agree with that 100%. And I agree with you. There's opportunities to comment on these podcasts on whatever
Mhm.
platform you're listening to. So I encourage people. We'd love to hear from you, hear your comments and questions so we can address them in future episodes and whatnot. But I'll say, so, meaningfulness, wanting to do stuff that really matters in life.
Yeah.
The second thing, as I mentioned, there's two things. The second thing is, particularly on the addiction side, right? And I know you and John have years of history in addiction, right? God bless you guys for your commitment, what you're trying to do in addiction. I haven't worked in the addiction space. I've worked in the pain space. I've had companies in the pain space,
Oh, mhm.
but never in the addiction space. But I'll tell you this, since I got involved with this company about 9 months ago, focused on addiction, and I asked, it doesn't matter where I am. I'm out about whether I'm at a conference or I was at a holiday party, right? And somebody asked, well, what are you up to lately, Will? Well, let me tell you this company that I've got that's trying to help tackle addiction. It's almost guaranteed every single person I talk to says, I've got an addiction story for you.
Yeah.
Right? It's my
It's
brother,
heartbreaking.
it's my mother, it's
Heartbreaking.
my friend,
Mhm.
it's my spouse, it's my child. It's overwhelming. Almost everybody I talk to shares their story, and it's all powerful. Every story you hear is, while it's all under the umbrella of addiction, they're all different, and they're all a struggle, and they're all a battle, and they're all a fights, and it goes like this, and there's highs and there's lows, and I love to hear it. I ask them deep questions. Tell me about it. I want to know, what was it when they say when they say they're on the road to recovery. I want to know, what was it? What was that little thing that happened that set that person on that road to recovery? And it's all different. It is all different, right? And a lot of it is intervention from a patient or a doctor or a friend or a brother that made a huge difference in this person's life, or not. I've heard stories where they haven't been successful. And one guy, like I mentioned, the guy was talking at a holiday party. He lost his brother to
Yeah.
addiction. He lost his brother,
Well,
and
yeah,
it just hits
this
you
industry
hard.
will
And that,
change you. Every homeless person you see from now on, you'll wonder what their story is. Every homeless person
Mhm.
you'll see, that was someone's brother. That no one goes to high school and is like, I'm going to end up the homeless guy on the corner. No one,
no,
right? And those are the things I think of because I'm a frontline treat person, right? Like I thought when I went back to school, I was going to be Brene Brown, and she's a wonderful researcher, and I admire her so much, and I love how she talks about therapeutic interventions. And I wanted so badly to be as good as Brene Brown. I am a terrible therapist. And I'm great at collecting money from insurance companies, and I am great at making insurance companies pay, but I am horrible at therapy. So going to therapy or giving therapy, I have to leave my skills in the office. And when you see those unfortunate souls who are just hurting, and I mean,
uh-huh,
they all have underlying mental health conditions.
yeah,
I have a friend that always says happy people don't do drugs. Well, maybe they did at first, right? It started out as a social experiment. But when you're addicted, you are not a happy person.
mhm,
And so,
no,
the depression, the anxiety, and sometimes drugs cause additional harm, right? Like I would say most of the time, right? But obviously I'm not a doctor, but that is the struggle. It changes your worldview
it
forever.
does,
So,
it does. Well,
and
and to
John, as
that
far as
point
pain,
about,
oh, sorry, go ahead.
no, I was going to say, to that point we just said about mental health being a part of it and the challenges. Interesting perspective I got from a woman I was talking to, who had a brother who suffered from addiction his entire life, right? And she said, what's interesting is when they're chasing those opioids or whatever it is they're chasing, right? Whatever drugs they're chasing, they're not chasing that to get high. They're chasing that to not feel
Yes,
bad.
yes, 100.
That's what they're doing. They're chasing that just to not feel bad,
Yeah,
right? Because without it, they're just absolutely miserable and feel just that craving is just wrecking their body. So the high is gone. It's just they need to get that just to feel like they need to do that to survive,
yeah.
right? And when you
Well,
hear that, what these people are going through, it just, you want to help. You want to do anything you can to help.
yeah, I would say that there's anything evil in this world, it is addiction. It takes a hold of someone's soul and just twists it. It's so painful. So, John, when we talk about addiction, a lot of the time it is opiates because that's the splash in the news, right? That's what we get funding for. Those are the things that people now have accepted are true addictions, and it's been forever. I mean, I remember not too long ago when we couldn't even get Medicaid reimbursement for MAT treatment. It was so unacceptable because the only way to treat an addiction patient was abstinence. Just don't do it, right? So everybody had to pay cash if they wanted MAT. Medicaid didn't even cover it. So, I mean, that wasn't very long ago, honestly. That was, gosh, I mean, we were still early, I would say we were still 2012, 2014. This was still kind of the way it was in most states, right? So, but the other big one is alcohol, right? I mean, how many alcoholics have you seen where opiates and alcoholics, I think, are the two that are really the hardest to help someone navigate through their addiction. I mean, they're all terrible, right? But these are the ones that last the longest. But for pain, John, I mean, how many pain patients have you seen that become, I guess, substance dependent? And then they lose their insurance or they can't get a prescription any longer because their doctor doesn't want to prescribe anymore. They won't go to a pain clinic, and so they end up using illicit substances. I mean, if you had 10 patients, how many would you say that affected?
7,
Yeah.
because the other 3 are already dead.
Took
I
a
mean,
left
it's the
turn
Wow.
there.
saddest thing. It's the saddest
It's
thing.
true.
You
It's
know,
true.
I'm sorry to be, I'm sorry to be so negative, so to speak, but we need to do something. And Will is correct because um, there are many, many people. 1 in 4 Americans know someone with an addiction problem.
Mhm.
And you know what? Many times we treat patients with addiction with jail, judicial incarceration. And, opioid use disorder is a chronic medical disease. And we treat it with jail. That's not right. That's not medicine. We know that medications can reduce opioid overdoses by 50%, but they don't get medications. And the worst part of it is these patients that go to jail, 20% of them can get opioids smuggled in, but they can't get medications that'll prevent the relapse, prevent the withdrawal symptoms, prevent the cravings. There's a lot of logistical problems, administrative problems, legal problems. You talk about the opioid epidemic. We're in our 4th decade and we're doing the same thing over and over again. We talk about abstinence. We don't talk about medications. We don't talk about holistic care of treating someone's mental health issues as well, because many of these patients have some sort of mental health comorbidity that's not being addressed. And, this is unpopular, but opioid use disorder is a symptom of a disease that really
Mhm.
develops from an etiology of something else.
Mhm.
Yep.
Depression, anxiety, someone gets addicted to medications, but there's a concept that many people in chronic pain have. They have opioid dependency, which is not opioid use disorder. And people are making the diagnosis of the two into one, and they're not treating it properly. And that's the problem. If these patients don't get medications because they're opioid dependent, they go through withdrawal and then they try to get more illicit drugs, which is really the problem.
So in the
Mhm.
medical
Yeah.
world, when you go to conferences or you speak with other doctors, I mean, do you talk about that or is that kind of like a taboo subject in the pain world?
Well, it's a very difficult subject to really talk to doctors about because most doctors are afraid.
Yeah.
They're afraid of prescribing opioids. They're afraid of their patients because patient satisfaction scores, if you're a doctor and you don't give an opioid, they're going to blackmail you. And many doctors are really hesitant to
What do you
prescribe
mean
opioids.
by that?
Well, if I prescribe an opioid and a patient overdoses and dies, the DEA comes after me. The district attorney comes after me because they'll say that I did not follow my patient properly. I did not inform them of the dangers of opioids. I did not look at their medication adherence. I did not follow them with enough office visits. And, they can put me in jail for murder.
Yeah.
which makes me, I went to 12 years of school. And if a patient overdoses and dies, the DA, the FDA, sorry, DA and the district attorney can come after me and put me in jail. That means I don't see any more patients anymore.
So do you feel like your colleagues, there's a vast majority, if you had 10 colleagues with you, how many of your colleagues would say they feel this way?
10.
Yeah. Interesting.
No one is prescribing opioids. And you have, like, for instance, one of my relatives had a total knee operation. That's one of the most painful operations in the world, where they take out your bone and put it in a piece of metal. It hurts for a long time. And the doctors give you Tylenol and Motrin. And, doctors have been so afraid that there's been a reduction in opioid prescriptions of 44% in the last decade. And for terminal cancer pain, it's 40%.
Yeah, there's
So
not much
these
of a
people have
reason
pain.
for that. I've heard you say that before, that we have patients that aren't being treated for their pain because doctors are scared.
Uh-huh.
Yeah. So
Right.
friends and colleagues, we clearly have a bigger discussion here around this. But if you want to weigh in, we'd love to have anyone that would like to talk about the example of the medication treatment in jails and the lack of addiction treatment in jails. We'd love to talk further about this idea of doctors not being able to get their patients out of pain. But we're running up on the hour here, gentlemen. Thanks for being my wingman, and
Yeah, no,
thanks for hanging
absolutely.
out with me,
Exciting.
talking about this industry and the problems. And hopefully in the future, we'll be able to touch on the pain points and really
Yep.
get more of our industry colleagues and friends to talk about those with us, and let that venting happen a little bit. It'll be good for all of us.
Yep. Absolutely.
Okay.
Looking forward to it. It's
All
going to be
right.
Thank you
good.
very much, Kendra.
Thanks for
Yep.
coming.
Thank
Have a
you.
great night.
All righty. Yep.
Remember to subscribe.
That's right. And like it if you like it. Give us a like.